What causes bipolar disorder? Bipolar disorder is a mental health condition that causes extreme mood swings that include emotional highs called mania or hypomania and low emotions also called depression. When depressed, the person may feel sad, hopeless and lose interest in most activities. When the mood swings to mania or hypomania, you may feel full of energy, euphoria or unusually irritable. This mood swings can affect sleep, energy, judgment, behavior and ability to think clearly. Symptoms: Bipolar I disorder. This is when you've had at least one mania episode that may be followed by hypomania or major depressive episodes. Bipolar II disorder. This is when you have had at least one major depressive episode and at least one hypomanic episode but you have never had a manic episode. Cyclothymic disorder. You have had 2 years or more of many periods of hypomania symptoms and periods of depressive symptoms. Other types of bipolar disorders induced by certain drugs or alcohol or due to a medical condition. This includes Cushing's disease, multiple sclerosis or stroke. Bipolar disorder can occur at any age but it's diagnosed in the teenage years or early 20s. Symptoms vary from time to time and from person to person. Mania and hypomania. Mania and hypomania are two distinct types of episodes but have the same symptoms. Mania is more severe than hypomanic and causes more noticeable problems at work, school, social activities and relationships. Mania may also trigger a break from reality, also called psychosis, and require hospitalization. Manic and hypomanic episodes include the following symptoms: increased energy, activity and agitation, lack of sleep, excess talkativeness, racing thoughts, poor decision-making. Major depressive episode. These symptoms are severe enough to cause noticeable difficulties in day-to-day activities like school, work, social activities or relationships. An episode includes these symptoms: depressed mood like feeling sad, hopeless, empty or tearful, loss of interest or feeling no pleasure in all activities, weight loss, increase or decrease in appetite, insomnia or sleeping too much, fatigue or loss of energy, thinking about or planning suicide. Symptoms in children and teens. Children and teens may have distinct major depressive, manic or hypomanic episodes. The pattern can vary from that of adults with bipolar disorder. Moods may also rapidly shift during episodes. The most recognizable signs of bipolar disorder in children and teens include severe mood swings that are different from their usual mood swings. When to see a doctor. Even with the mood extremes, people with bipolar disorder often don't recognize how much their emotional instability affects their lives and that of the people around them. They also don't get the treatment they need. It's advisable to see a doctor when you have feelings of euphoria and cycles of being more productive than always, followed by an emotional crash that can leave you depressed, worn out and in financial, legal or relationship trouble. What causes bipolar disorder? The exact cause of bipolar disorder is unknown but several factors may be involved. This include genetics. If you have a parent or close relative with bipolar disorder, there is a high likelihood of having the disorder. Biological differences. People with bipolar disorder appear to have physical changes in their brains. A long period of high stress, drug or alcohol abuse. Complications. If not treated, bipolar can cause serious problems that may affect every aspect of your life. This include suicide or suicide attempts, legal and financial problems, damaged relationships, poor performance in school or workplace. Prevention. There is no guaranteed way of preventing bipolar disorder. Getting treatment at the earliest sign of a mental health disorder can help prevent bipolar disorder from worsening. If you are diagnosed with bipolar disorder, preventing minor symptoms from becoming full-blown episodes of mania or depression is the best approach. This may include: avoid drugs and alcohol. Take your medication as advised by the doctor. Pay attention to warning signs. You may have identified a pattern to your bipolar episodes and what triggers them. Call your doctor whenever you feel you are falling into an episode of depression or mania. Diagnosis. The following evaluation is done to determine if you have bipolar disorder. Physical examination. The doctor may do a physical examination and lab tests to identify any medical problems that could be causing your symptoms. Psychiatric assessment. The psychiatric will talk to you about your thoughts, feelings and behavior patterns. Mood charting. The doctor may request you to keep a daily record of your moods, sleep patterns or other factors that may help with diagnosis and treatment. Children who have bipolar disorder are frequently also diagnosed with other mental health conditions like attention deficit and hyperactivity disorder or behavior problems, which can make diagnosis more complicated. Consulting a child psychiatrist with experience in bipolar disorder is highly recommended. Treatment. A psychiatrist is the best medical doctor to treat bipolar disorder. The treatment team may also include a psychologist, social worker and psychiatric nurse. The primary treatment of bipolar disorder include medication and psychological counseling, also known as psychotherapy, to control symptoms. It may also include education and support groups.